Hi, my name is Dr. Jamie Gallant, and today I hope to give you a little bit better of an idea of what naturopathic medicine is about and how the process of treatment unfolds in order to help you become optimally well. The first question we have to ask today is, why are we so unhealthy? Obesity, diabetes, heart disease, cancer, and autoimmune disease rates are skyrocketing, sometimes even at a young age. There are many reasons why this happens. It's generally agreed upon, in my profession at least, that these four things listed generally compromise the body's ability to adapt to stress and generally disrupt overall homeostatic mechanisms, meaning the ability to maintain balance within the body. We all agree that toxins can be a big problem. Dietary issues can be a big problem if you're living on junk food or fast food and not eating enough fruits and vegetables, or you're eating foods that are coated in pesticides or genetically modified. That tends to be a problem. We all agree that stress tends to be a pretty big contributor for chronic disease. Emotional stress, even stress when it comes to overwork, working long hours, not sleeping enough. That tends to contribute to the generation and also progression of most diseases. And also, we all agree on inactivity. If people are not exercising enough, or not exercising at all, or not moving much, we know that disease rates increase quite dramatically. There was even a recent study done about this with regard to sitting. If people sit for several hours a day, it was found that they have higher risk of any and all diseases, especially the chronic ones. Now, even if they exercise for 30 minutes a day, it didn't really matter so much. If a person was sitting 10 or 12 hours a day, they still had that increased risk, meaning it was an independent risk factor. So the longer you sit, it's almost like smoking. You don't want to be sitting stagnant all day long because that will increase your risk of most chronic diseases. So the question is, how do we stay well? Our bodies are born generally fairly balanced. There are exceptions to that, but for the most part, people are fairly balanced when they're born. Their body has fairly good vitality and generally will adapt to stress reasonably well. So how is it that we disrupt this process? Well, generally it tends to be our lifestyle. Our lifestyle, our choices, our diet, our lack of exercise, and our general perception to our life and how we deal with our emotions tends to contribute to a lack of vitality and a lack of ability for the body to get well. In naturopathic medicine, we use a number of different approaches to integrate the overall system to try and improve vitality of the body and to decrease stresses on all layers, whether they be biochemical, structural, or emotional, or energetic. So let's go through some of these tools. The tools that we generally use or usually use, some of them we almost always use, is nutrition and botanicals. I was just touching on this recently. Nutrition is exceptionally important. Good nutrition won't always cure disease, but a bad diet will always aggravate a disease if you have one, and pretty much eliminate the chance of you getting better if your diet is poor. No matter what drugs or chemicals or natural remedies or magic holy grail treatments you do, if your diet is terrible, the disease may temporarily get better, but eventually it will come back, guaranteed. The other tool that we tend to use is botanicals or herbal medicine. Herbal medicines have been used for thousands of years, and they were known to have healing properties and various balancing properties since the beginning of time. It's one of our oldest modalities. It turns out that current research is starting to substantiate a lot of the traditional uses of these herbs. So interestingly enough, we think that we're quite smart, but these native shamans and indigenous medicine men, they knew what these herbs were doing thousands of years ago without the benefit of double-blind studies or modern laboratories. So I generally tend to pay attention to some of the traditional uses of herbal medicines because it tends to bear out most of the time. Exercise. You cannot possibly be healthy without exercising at least a little bit every day. Lack of movement, just like the sitting thing we were talking about, tends to stagnate your circulation and your overall ability of your lymphatic system to move fluids around. When you don't move fluids around, you don't take out toxins very well, and you don't deliver good nutrition and oxygen to various tissues of the body. When that happens, disease is not too far around the corner. So there are many ways of exercising. It's not that you have to go run a marathon or that you have to be a bodybuilder. You have to just find the right fit for you, but you just have to find something that you're willing to do and do it consistently. And we know that reduces the risk of almost every disease. There was even one study showing that doing a 30-minute walk 4 times a week, a brisk walk, reduced the risk of many diseases by almost 50%. So it is something that I strongly encourage. If people are not doing some form of exercise, they're really shortchanging themselves when it comes to manifesting optimal health. The next tool that we'll talk about is structural therapies. The body is made up of bones, cartilage, ligaments, tendons, muscles, viscera. All of these tissues have to be in the right place at the right time. They have to have the right level of tension. They have to be accurately communicating with your brain. And if any of those things are not doing that, the function of those tissues are not going to be optimized. They're not going to be as good as they could be. In chiropractic medicine, the underlying philosophy is that when the segments of the spine are out of alignment, the nervous system is somehow disrupted. So therefore, the nervous system is not communicating with the body very well, and that leads to increased risk of diseases, not only just pain. So in naturopathic medicine, we tend to incorporate chiropractic-like treatments. I myself adjust most of my patients, except for the ones that have major phobias of adjustments. But I find it very, very helpful. If you have a segment that's out of alignment, it is a constant stress on that nervous system. And so getting that segment to move correctly, be in the right position, stop sending stress responses to the brain, can be a very powerful therapy to helping move a person towards better wellness. Another therapy we use is nervous system retraining therapies. So there are many types of these therapies, but 2 of the ones that I use are trigenics and pain neutralization technique. Essentially, it involves testing muscles, seeing whether or not they're strong or weak, and then doing various gentle manipulations to try and get those muscles to work properly again, to bring that strength back. Also, if a muscle is shortened, meaning it's too tight, there are certain ways of stretching it and doing types of active release where it gets the muscle to stretch out to the proper length to allow the joint to move correctly. Pain neutralization tends to be more about normalizing reflexes, where I touch different tender points, sore spots on a ligament, tendon, bone, muscle, you name it, and then I do some gentle manipulations or stretches to try and reset the nervous system communication with that tissue so the pain is eliminated, and also circulation is restored to that muscle, ligament, or bone, or to the deeper tissues to allow healing to happen. Very, very powerful therapy, probably one of the most powerful therapies that I've ever seen when it comes to treating chronic pain. I've seen people with reduced range of motion in their neck where they can't turn their head for years, and they've been doing chiropractic, massage, acupuncture, injection therapies, you name it. And after doing 8 weeks of pain neutralization on their neck, they can turn and shoulder check in traffic for the first time in 15 years, which is really wonderful. So it is a great therapy to incorporate in the overall treatment plan for many patients. The other type of therapies that is almost unique in naturopathic medicine, and especially American chiropractors, I find, are various mind-body therapies, things like TBM, applied kinesiology, emotional freedom technique, and neuromodulation technique, NMT. They tend to focus on using the intention of the practitioner, or the practitioner's muscle testing muscles, but they're asking various either verbal questions or internal questions to get a response of weakness or strength. Or what they're doing is they're touching different reflex points to seeing whether or not it changes the strength of the arm. What that is a metaphorical construct of helping restore optimal communication in the patient's nervous system. So what's happening is that, say you have an allergy and we're using, say, a vial of a pollen or a food, and we'll hold that vial close to your chest, and then we'll test your arm to see whether or not the arm becomes weak. From there, we try to normalize that reflex by touching different reflex points to see what neutralizes that, and then we correct that organ system. That's what TBM's procedure looks like. EFT and NMT tend to be a little bit more, especially NMT, more informational. But what I found is that all of these therapies are very, very good at helping restore old memories, old patterns, old information in the nervous system. Almost like if you've ever eaten something when you're sick a long time ago, say it was chicken soup, and then 5 years later you find that you still have those memories of being sick when you eat chicken soup. So what happens, that's because your body's remembering that stressful event every time you taste the chicken soup. It's a negative association. And so I find these mind-body therapies are really good at getting out these associations in your nervous system. Some of this is in your brain, but some of this is actually in your spinal nervous system. So it's not consciously present in your own thought process, but your body is storing these old stress responses. So these techniques tend to train out those old responses that are leading to disease. In TBM, NMT, and a number of other therapies like NAET, an allergy is really just an overindulgent stress response of the nervous system to a particular food, pollen, inhalant, or body tissues that's leading to this allergy activity. So retraining these associations can be very helpful. Other tools for harmony tend to be things like spiritual healing, evolution, and fulfillment. We know that meditation, yoga, changing your perspectives in life, finding a functional therapeutic way of seeing the world in such a way that is uplifting, positive, and has meaning, we know that tends to improve the health of people. There have been many cases of people that have certain types of emotional releases and have a serious disease, and then the serious disease suddenly goes away, and it's like a sudden remission. So we generally tend to encourage people find their own spiritual path and use different tools to make sure that they're facilitating their own connection with the Creator or their internal self in a way that really makes sense to them. And that's not necessarily a religious thing. It can be, pretty much any type of therapy you can think of, whether it be meditation, yoga, various types of mantra, rituals, you name it. We'll talk about some of that later on in this lecture here. Another tool for harmony is homeopathy and biotherapeutic drainage. Biotherapeutic drainage is a use of various homeopathic remedies to try and stimulate balance of different organ systems and to also stimulate optimal elimination of toxicity out of these organ systems. The theory in biotherapeutic drainage is that whenever an organ system is having a problem, it is essentially just a buildup of toxicity from overall metabolic debris or external toxins that we're being exposed to that blocks up that organ system so it doesn't function in a balanced way. So giving biotherapeutic drainage remedies on a consistent basis tends to clean out those organ systems and balance their function so they can start doing what they normally want to do. The goal in naturopathic medicine in general is just to relieve the obstruction to cure, or relieve the obstruction of why the body is not balancing itself. We don't necessarily treat any disease, we treat people. From there, we try and treat the underlying blocks in the body that keeps the body from being able to execute a healing process. And biotherapeutic drainage is really interesting, their philosophy, because we'll talk about, say, sinusitis. Any disease state or symptom is really a body's expression of trying to get rid of something that shouldn't be there. So we really shouldn't be suppressing the sinusitis or suppressing the symptom that a person's having. What we should be doing is encouraging proper drainage of that toxin internally that the body's trying to get out. In an obvious example, we can think of fevers. We know now that fever suppression is really a big problem. In our culture, we've been taught that running a 100-degree fever is a big deal. It shouldn't be a big deal. Suppressing those fevers is not a good idea. The more you suppress them, the more you develop allergies and other types of disease. So there's been one recent study, probably a couple of years ago actually, if I remember correctly, that children that got exposed to Tylenol a couple times a month had 3 times the risk of developing asthma and allergies. Why is that? Because the immune system is trying to get rid of an infection. We're trying to block that response, so the immune system has to find some other way of executing a healing response, which often is an imbalanced healing response because we suppress the proper way of doing it. From there, the body has to express itself in an unbalanced way and develops other types of chronic diseases. So conventional medicine and drugs can be very useful in a crisis and an emergency. By no means don't refuse antibiotics when you've got a clear-cut horrible bacterial infection and you're running a 105-degree fever. But when we're looking at most people, most of the time people are having a general low-grade response of something, and then just out of convenience state they're trying to suppress, and that tends to really drag down your health over the long run. So I discourage people from doing that if they can. Some of the general tools for longevity that we are going to talk about today is one, nutrition. We've touched on that. Here's some general advice when it comes to nutrition that most of the fad diets, most of the healthy diets all agree on. Eat organic, avoid pesticides, avoid plastics. Essentially eat clean food. Don't eat genetically modified food whenever you can. Genetically modified food has a different genetic makeup than food. Our body doesn't recognize it the same way. And there is some research to suggest that it disrupts our optimal gut flora. There are 10 times as many bacteria on an us as there are human cells. And when you eat genetically modified food, it tends to change that. Has been interesting research to suggest that even depression can be related to bowel flora changes. Anxiety can be related to that. Inflammatory diseases can be related to that. So the gut flora is something we want to preserve. Funny enough, it seems like it's an endangered species lately because with antibiotic use, chemical plastics, and genetically modified foods, these gut bacteria are changing dramatically. And this is a major underlying cause of why people are getting sick. It's fairly well known that you should reduce sugar in your diet. But one of the misunderstood things is fat. Fats can be very, very good for you. There are very, very healthy fats. You don't want to eliminate fat from your diet, but you want to eliminate the unhealthy ones. The unhealthy ones tend to be the fried, processed vegetable oils that are chemically treated. Chemically treated oils, or the liquid oils that you find in the supermarket, one of the major exceptions would be extra virgin olive oil or maybe avocado oil. Most of the polyunsaturated fats that are sitting at room temperature that have been chemically extracted or heat extracted, very, very bad for you. It's like throwing gasoline on the fire when it comes to aging. I would get those out of your diet, absolutely. The healthy fats you want to encourage are things like extra virgin coconut oil, extra virgin olive oil, grass-fed butter is a very healthy fat, and fish oils. Another type of fat mixture that you can buy from most health food stores is called Udo's oil. It's a very healthy mixture of healthy fats. You just take a tablespoon a few times a day to get the good fats in your diet. The good fats tend to decrease inflammation. They tend to decrease obesity. They actually help you lose fat. They really nourish the brain nicely, so they'll help you with depression, anxiety, all sorts of brain problems, where the unhealthy fats will accelerate all these disease processes. So if you cut unhealthy fats out of your diet and cut sugar out of your diet, I guarantee you almost everyone that does that, within 2 months, they'll probably lose about 2 inches off their waist, maybe more, depending on how unhealthy their diet was to start with. Another general suggestion that pretty much everyone agrees on is increase the color of your diet. The brightly colored vegetables, berries, and foods are full of antioxidants and flavonoids. These nutrients tend to turn on good genes that slow down aging and turn off bad genes that speed it up and accelerate cancer growth and inflammation and all sorts of markers of poor health. So increase that color. Make sure you have, some purples, some blues, and lots of greens and oranges in your diet every day. Emphasize whole, unprocessed foods. If it's in a package, it's been, processed a lot, chemically treated, extracted, and then fortified after the fact to try and put back 1% of the nutrients they took out in the first place, probably not the best choice for you. The other thing I tend to look at is, what did our forebears eat? What did our ancestors eat for thousands of years? They didn't eat processed foods. Even breads and grains, having some of that is not a big deal. But when we think about it, people with indigenous background, cavemen, any of those types of ancient cultures, they didn't they didn't really process grains a lot, and when they did, it was the whole sprouted grain, and it was not really altered or monkeyed with too much. So when you eat grains, if you are going to eat them, make sure that they're not processed. Make sure that they're whole and sprouted and organic. The other concern I have is make sure they're not genetically modified. And now with some new books coming out, some new research, things like Grain Brain and Wheat Belly, we're starting to realize that when you eat too much wheat, especially the non-organic wheat, you start interfering with your overall digestive process, your hormones, everything. And I have seen people that just cut wheat out of their diet and they don't do anything else and they lose dramatic amounts of weight. And when we do blood tests, it's a common food sensitivity. Wheat and dairy tend to be the common ones. So I would encourage people to consider a trial of a couple weeks of not eating any grains or gluten or dairy and see how they feel. And if they notice a big change in their health, maybe those foods are not very good for them. The last misunderstood concept is the traditional Chinese medicine emphasis of dietary choices. With all the fad diets today, everyone's talking about, well, you should go vegan, vegetarian, or you should go paleo, or whatever. There's always a new diet that's always restrictive and it's always slanted in one way or another. What I would suggest to you is that the right diet for you today is not the right diet for you a month from now. Foods that you eat should be based on what is going on in your system at this time. If your body's really cold, if you're cold all the time, you live in a cold, damp environment, you have poor digestive function, you have a weak appetite, I would tell you that eating vegan would be horrible for you. Because what veganism is mostly eating very, very cold foods. In traditional Chinese medicine, the stomach and spleen need some warmth. They need some balance there with the temperatures. If you're eating chronic cold foods, you damage your digestive process. There have been many practitioners that have echoed this in various other ways. John Madsen in his book Eating Alive, he talks about this quite a bit too, showing that eating too much raw food tends to irritate the ileocecal valve, which is an important trapdoor in your small intestine that prevents the bad types of bacteria and various other types of bugs from traveling up into your small intestine, disrupting your overall digestion. So what I would suggest to you is you try to eat somewhat seasonal. If things are growing in that season, you tend to eat more of those foods. In the winter months, if you live in a cold, damp climate, you have more soups and stews, a little bit more salty things, and you have maybe a little bit more meats, especially the organic, unprocessed meats. I'm not suggesting that you should be eating grocery store red meat because that's coated in carcinogens. But grass-fed bison, grass-fed moose, deer, all those types of wild game tend to be very helpful or healthy for you. And grass-fed, obviously grass-fed cows tends to be very good too, and also chicken and fish. But some vegetarians will say, well, I eat fish, but I don't eat any meat. Well, fish is considered cooling in traditional Chinese medicine, so in the winter months, if you're eating just fish and you never, ever, ever have any red meat, that might contribute to some imbalance within the temperature of your body, and that will contribute to overall digestive problems. On another note, if you're eating all fried, greasy foods, that's too hot, and so that's definitely not balanced either. So what I would suggest to you is that you eat somewhere in the middle. You eat a little bit seasonal. You make sure in the winter months you eat more of the meat, more of the soups. In the summer months you eat more of the raw vegetables. You're going to do that, but you don't eat a lot of raw, undigested vegetables. You steam and salt them in the winter time, and that tends to make them more healthy for you. Other things we think about in longevity is adaptogens and various other herbal medicines. There are a number of herbs that we know about in Ayurvedic medicine and traditional Chinese medicine and indigenous medicine that were always used not for treating disease. They were used to keep you healthy. They were used to extend lifespan. They were used to give you more vigor and life force and just ability to thrive during stress. We call those adaptogens. They're wonderful, wonderful herbs. The right type of adaptogen for you may be different for you compared to someone else. But what I recognize is that almost everybody needs to be taking an adaptogen fairly regularly if they want to be optimally healthy and if they want to maintain their energy. So I would encourage you to talk to your local ND about the right adaptogen for you, do the appropriate testing, and also case history so you can get an idea of which herb generally matches you the best. But most of these tonics, like Siberian ginseng, ashwagandha, rhodiola, astragalus, hishawu, and echinacea, tend to be very, very good for you. Echinacea is not considered an adaptogen in the truest sense. It's considered more of an overall immune tonic. One of the misunderstood concepts in conventional medicine about echinacea is that they think of it as an immune stimulant. It is not an immune stimulant, it is an immune balancer. Interestingly enough, a rat study done in the last few years showed a 20% increase in life expectancy to rats that consumed echinacea every single day. So that flies in the face of the conventional medicine understanding of echinacea. They would think of that as a short-term herb. You do it only for a little while, and then from there you stop it. But echinacea tends to be an overall immune balancer, so it's a very good herb. My only concern with adaptogens or any herbal medicine is if you're on certain medications. Sometimes herbs allow your liver to better detoxify certain things in certain ways, and sometimes that'll kick out a drug that you need. So if a person has kidney failure and they've had a kidney transplant, they need to suppress their immune system with various drugs in order to keep the immune system from attacking it. And if you take certain herbs, especially the wrong ones, what that will do is it'll increase the body's ability to excrete that drug, so your body will attack that new organ. Thankfully, that type of caution isn't really warranted for most of us. So these herbal tonics tend to be very good for you. I'm always taking one myself. Generally, you could think about rotating, taking different ones from month to month, but they provide an awful lot of good for you. Siberian ginseng, for example, tends to be a very good adrenal tonic, meaning that it helps you just adapt to general stress. It helps you with burnout. Ashwagandha, same thing. We also know that ashwagandha tends to balance up a thyroid, so if a person's slightly low thyroid, ashwagandha will often pick it back up. Astragalus root tends to be known as an immune stimulant, or not really an immune stimulant, but that's what they think about it in the health industry as. But it tends to be more of an immune balancer, and in traditional Chinese medicine is more of a qi and spleen tonic. So it helps improve overall spleen function and also improves resistance to overall viral infections and disease. He Xia Wu is a traditional anti-aging tonic, and in traditional Chinese medicine they also use it for gray hair. So taking that regularly for months at a time can actually reduce your gray hairs and bring color back to your hair. That's how wonderful it is. One of the mechanisms besides just hormonal function and brain function that the adaptogens work through is also through gene modification. The tonics, like the adaptogens, tend to turn on good genes and turn off bad genes. One of the examples of a really good example of this is curcumin. Curcumin tends to be very anti-cancer because it tends to turn off various genes, several of them actually, that contribute to growth and metastasis of various cancers. So long-term intake of turmeric that contains a lot of curcumin is known to decrease overall cancer risk and overall arthritis risk throughout life. So consuming these types of things on a regular basis can be very helpful. And of course, looking at the person's general tendency from a traditional Chinese medicine standpoint, and also electrodermal or biofeedback or applied kinesiology testing can be very useful for trying to find the right herbs that fit that person. Another one of the things that we consider when we're treating patients to try and optimize their health is nutritional supplementation. Nutritional supplementation works through a number of mechanisms. I'm sure there's several mechanisms it works through that we don't understand yet, but we do know that it helps with managing free radical stress. Free radical stress tends to be the overall rusting process that happens inside your body, and that's from burning oxygen for energy. There's these things called free radicals that are generated that tend to increase inflammation, and they tend to sort of be like little fires that you have to put out in order to keep yourself from damaging yourself during that energetic process or the process of developing energy from oxygen. So vitamin C, vitamin E, various flavonoids, all the things that make fruits and vegetables colored help with that free radical stress. Nutritional supplements tend to support energy metabolism. There's certain things that allow food to get into the right place at the right time. There are supplements that allow your blood sugar to balance better. They allow you to put sugar inside the cell as opposed to let it float around in the bloodstream. There are supplements that allow fats to get inside the mitochondria, which is essentially the blast furnace of the cell. And so supplementation of various things can be very helpful for overall energy and overall disease prevention and helping things like cholesterol, blood sugar, blood pressure, you name it. And as I talked about briefly, gene expression can also be affected by various nutrients just like herbal medicines. There are some B vitamins like folic acid and B6 and B12 that affect something called a methylation process. And one of the mechanisms that the body turns on and off genes is through proper methylation. Now, when you're deficient in folic acid, B6, or B12, those processes tend to shut down and you're not able to regulate your genes very well. So it can be a very big instigator for cancer if you're running low on those nutrients or you have an imbalance in them in some way. The other great thing about nutritional supplementation is that it gives the liver the proper things for balanced detoxification. People often think of detoxification as just starving yourself and letting the body clean itself out. That's not entirely the best way to detoxify. Sometimes the liver needs certain nutrients to package the various toxins properly so that they get out. Otherwise, what will happen is that you can stimulate toxins and they just float around, and sometimes they can be even more irritating floating around in your system than they are when they're properly packaged. And so there's a couple-step process that is involved that we'll just talk about in a moment in order to properly detoxify a nutrient in a balanced way. Otherwise, you might actually increase the risk of some diseases or problems. The other thing I like to think about are super nutrients. There are certain nutrients that we know seem to really improve overall risk of disease. They tend to improve overall health, vitality, energy, body composition, you name it. And so, this is a list here. It's obviously a multivitamin that has got some detox support in it. Coenzyme Q10, vitamin D, K2, vitamin C, E, selenium, omega-3s and other healthy fats, high-quality protein, and probiotics. Those are all things that are worth considering for most people. Probiotics, I guess I should talk about right now. We were talking about the gut bacteria and how the gut bacteria affects depression and inflammation of the gut and your overall immune function and everything else. Well, probiotics tend to be the good bacteria that fight off the bad guys. So I usually will prescribe probiotics of some type or another to most patients, or to the vast majority anyway. And most people notice their bowel movements will improve, their overall mood will improve over time, the resistance to infections. So with kids, for example, if you give them probiotics, often parents will report, geez, my kid doesn't get sick quite as often as they used to. And the reason why is there is a bacteria imbalance in their gut that's constantly dragging down their immune system, because their immune system is always fighting with these bad bugs. So if you give them probiotics, these good bacteria, they're almost like bouncers for you. They go in there and they start fighting off the other bugs. They actually start creating different types of chemicals that tend to improve immune function, improve the gut lining, and also they start to inhibit the other infections going on in your body. So they're really wonderful to have. This is another one of the reasons why I don't advocate regular antibiotic use unless absolutely necessary, because when you kill all your good bacteria in the gut, you tend to leave an open space for all the bad guys to move in, which usually leads to poor health. So the next thing I'll talk about that I touched on very briefly is detoxification pathways. This is an illustration of how we properly detox. And this is one of the reasons why nutritional supplementation can be very helpful, because as you can see, step 1 requires all these nutrients. This is with step 1 when we have a fat-soluble toxin. Step 1 will alter that toxin in such a way that it'll end up here. Now, funny enough, if you're short on these nutrients, this toxin here actually can be more toxic than this one, and it will float around in the system and irritate tissues and cause no end of problems. So it is very, very, very important to be properly nourished when you detoxify someone. If not, you will cause yourself a lot of trouble. So I generally supplement people with various compounds like these based on testing to help the person do step 1 and step 2 properly. And then we also stimulate the gallbladder and kidneys with either drainage remedies, herbal remedies, whatever it may be that tests well, to try and make sure that the gallbladder and kidneys are eliminating properly. The other thing we talked about, I talked briefly about, is pain neutralization and trigenics but they're nervous system therapies. They're really about how the brain talks to muscles, tendons, ligaments. The other types of techniques are like neural therapy and neural prolotherapy and acupuncture. Those are all injection or needle-based techniques. They're all about resetting reflexes or feeding damaged nerves to get the nerves to heal so then they start communicating properly with tissues. Very dramatic therapies for chronic pain. And there have been some cases where people have a regeneration of a hip or an osteoarthritic joint from just superficial correction of reflexes along the skin, which is crazy. But what it does, it's restoring proper circulation to that deeper joint, and then the joint starts to heal. So we generally incorporate this in many patients' treatments, because if they have a lot of this type of nervous system imbalances going on, you can feed them as well as you want, but you've got to restore that communication, and this is one of the great ways of doing that. Energy medicine is one of the out there therapies that many people don't understand, but energy medicine is really a transmission of information from the practitioner to the patient to allow for better body communication. You could almost think of it as downloading programs, just like downloading programs into a computer. One of the therapies I tend to use a lot of is TBM, another one is NMT. The gentleman that taught me NMT, for example, Leslie Feinberg, he will treat somebody that's been anaphylactic to peanuts or shrimp for 30 years. He'll treat them that day, and within usually 1 to 2 treatments, they can eat that food again and they never react again, or if they do, it's a long time, several months later, and they just need a tune-up. So that shows the power of this therapy. I mean, all he's doing is muscle testing and asking questions, and then essentially talking to the subconscious nervous system of that patient, and then delivering corrections through gentle stimulation of different spinal segments, and essentially a corrective statement, meaning almost like a verbal statement of how to correct this dysfunction. And so for most of the people that are not open to this or not really aware of what's going on here, they would think he's doing nothing. But the results speak for themselves. He has literally a 99% success rate at completely healing various anaphylactic allergies and a number of other conditions such as autoimmune disease he has great success with as well. And I've had a lot of success doing this therapy as well too, with anaphylaxis and autoimmune problems and even chronic pain. Sometimes, for example, a shoulder will be sore and I'll do prolotherapy and all these other things, and it'll be mostly better, and I can tell there's nothing structurally wrong anymore, but what it is the information in the brain is still playing the old circuits related to the pain. So then when we do NMT or TBM work to try and clear that, then it gets better. So it's quite wonderful. It's really interesting. Your body is almost like a computer system, a computer hard drive that tends to hold on to a lot of information, and that informational content will create the physiology and how the body likes to communicate with itself. Some great resources to read on energy medicine and intentional treatment are Dream Healer and Entangled Minds. For the scientific mind, I would highly recommend they read Entangled Minds. It'll help you get your doubting mind out of the way and really look at the raw research. Therapies such as structural therapies we talked about briefly. Manipulation, we talked about with chiropractic, making sure things are in the right alignment and moving correctly. Prolotherapy is an injection therapy to improve ligament healing. So what we're trying to do is we're injecting dextrose and anesthetic into the ligaments and tendons to stimulate a healing response. And from there, the healing response starts to tighten up those ligaments to hold that joint together well. Very, very good for chronic injuries, car accidents, whiplash, dislocations, old ACL, MCL knee injuries, ankle sprains, you name it. It's one of the best therapies that I have for that. Wonderful, wonderful therapy. But even massage can be very good for structure too, because sometimes if the muscles are too tight, they're not allowing joints to sit in the right place because they're pulling it out. Massage is also good for improving circulation, lymphatic drainage, so I encourage people to do massage. It is a great therapy too. I don't do it myself. I do a lot of other things, but massage is very complementary to many things. And when it comes to structural problems, always consider that surgery should be the last resort. When you go to your doctor and he says, oh, it's bone on bone, you have no cartilage, we need to chop your knee out and replace it. Sometimes that is necessary if a person's in agony for a long time, but maybe try some other more conservative things first and see how that goes. Sometimes you can be surprised. Sometimes it looks like a pretty dim scenario, but the problem gets better and your pain is gone. It can happen. So don't do surgery unless you've tried everything else first. That would be my recommendation, unless there's some sort of emergency condition going on. The other thing we look at, and we talked about briefly, is spiritual health. It's a feeling of connection to one's divinity, congruence of day-to-day life with the values. So making sure what you're internally thinking and externally doing are kind of on the same page. Very, very important in life. I've seen a lot of people get very sick when they live in very, very bad circumstances that are compromising their congruence. Spiritual health is all about quieting the mind, learning to be, positive, learning to sit still, learning to not constantly be worrying about things in the future and the past. And we know that this profoundly affects your overall health. There is a great book called When the Body Says No by Gabor Mate. He's a medical doctor in Vancouver. And he looked at the research regarding MS, and he showed there was almost always a link with an emotional trauma and the development of MS. So I'm not suggesting that everyone that gets sick is, crazy or anything like that. What I'm suggesting is that somehow their ability to deal with a certain stressor or trauma in their life has somehow blown a circuit, and that creates sort of an overall immune imbalance. The reason why this is the case is that the nervous system and the immune system are not separate systems. I know in conventional science they look at it that way, but that's more for jockeying for research dollars and for competition between departments, but it's not really a separate system. To change your emotions, to change your ability to deal with stress is to change your immune system. There is no difference. And I myself have actually seen a strong link between people with panic attack disorder and anxiety and hay fever and allergies and how bad they are. As their anxiety gets better, their allergies are often worse. As their anxiety gets better, their allergies get better, and when their anxiety flares up or there's an emotional trauma in the family, sometimes previously better allergies will come back. So one part of the energetic medicine and spiritual health is the energetic field. There are various spiritual adepts out there that can see the energetic field. It's sort of like an aura of light and colors around the body. There is what you call a healthy energy field, and there's an unhealthy energy field. And so what we're doing is when we're doing various types of medicines, we're improving the health of that energetic field. And there's many therapies that affect that, including all your spiritual practices. Acupuncture will affect it quite a bit. Intention therapies, nutrition, stress reduction, improving your overall fulfillment in your life will help that quite a bit. And also the energetic field reflects the overall health and consciousness of the emotions and the spirit of that person. So doing various practices like Sanskrit mantra, meditation, yoga, all those things improve the energetic field quite nicely. I know in conventional medicine the energetic field is considered some sort of woo-woo or black magic or something, I don't know. But there's some great books, including Adam's book called Dream Healer, that talks about that quite extensively. And I encourage you to explore that if you get a chance. These are some spiritual tools that I typically find are very useful. For you, find the ones that fit you and make a lot of sense for you. But these ones tend to cover a lot of bases. One of them is actually from Tybro.com, which is Dr. Mitchell Gibson. He was trained as a psychiatrist and had a number of spiritual experiences over years. So he made it a lifelong goal now to provide people tools to help accelerate their overall evolution of consciousness, their ability to become happy and well. And so there's many resources that he has that I would highly encourage you to check them out if you're interested in these types of things. Another resource I find useful is SanskritMantra.com, which talks about how to use various types of ancient mantras in Buddhism and Hinduism to try and accelerate the overall growth and benefit of your energetic field. Now remember, this is not about religion. These are not religious practices. Think of mantra and various other practices as almost like dumbbells that you're lifting in the gym to strengthen different muscles. You don't have to have any sort of belief per se in them for them to work. But whatever your heart guides you to do, go check that out and see how that goes. So I hope today gave you a little bit more insight about what naturopathic medicine is about. This is a little bit more of my own unique perspective. Different naturopaths have different ways of doing things. But most of these general principles apply throughout the profession, and most people would agree with what I had to say today when it comes to our overall structure and how we think of overall health in people. So if you have any questions, feel free to give the office a call at 604-465-7745, and I'll be happy to answer your questions. Take care.